It is awesome when people recognize there's these light bulb moments. They're like, oh my gosh, this is how it's supposed to work.
1, 2, 3, 4.
Hello, and welcome back to today's Medical Sales Leader. And today I have somebody really special with me, especially if you are working in a practice or in an organization where sometimes things get a little bit tense or you're kind of feeling off with the communication or the dynamics with your team, which happens everywhere, by the way. So I'm so excited to bring on Becky Wolfe. Becky, how are you today? Thank you so much for joining us.
Claire, thanks so much for this opportunity to have this conversation with you. I'm super pumped.
Oh my gosh, me too. It's been a long time coming. Becky and I have been friends here, and we met each other here on LinkedIn, gosh, about a year ago. And since then, I have seen an incredible impact that she's having on healthcare, offices, teams, and so many other people. So though I know she is a woman who needeth no introduction, I'm going to talk about exactly what Becky is doing and up to these days. So Becky is a leadership consultant who helps burned out healthcare teams go from surviving to thriving. Wouldn't that be nice? And her goal is to help teams communicate and collaborate more effectively to reduce turnover and create cultures where everyone wants to work. So, I mean, this is an incredible mission that you have. And I'm pretty sure for everybody here who is listening, they're already thinking of the 1 or 2 or 10 places where they've worked, where they've experienced burnout and I don't know, toxic bosses, lots of, issues in the workplace. So the work you're doing here is so important. And I would love to first know, where does this passion to figure out what is going on in a practice and between people and then give them results and opportunities to fix it? Where did that passion stem from for you?
Yeah, so my background is that I was a PA for 13 years, and part of my practice was actually become a health coach. And I found out that I loved coaching more than I actually loved being a PA. And I didn't hate being a PA. I actually enjoyed that too. But there was something about the ability to help people get what they really wanted from health coaching. So finding out that consistency with information and accountability and just kind of walking with somebody to a goal that they had, that was just a driver for me, specifically in the coaching space. And then when I stepped back in healthcare and recognized that we weren't really doing what I thought was true healthcare, it was more so chronic disease management. That was a frustration point for me. So honestly, I started to feel burned out in cardiology because I was trying to make all these changes and I wanted to see all this change happen and I wasn't seeing it. So I kind of lost hope in our system. And I think from there, what happened was I ended up enrolling in a leadership course for myself because I felt really stuck. And I'm like, I have no idea. I have no language as to why I need something and I cannot figure it out. And I don't know if you've ever been there, Claire, but it's just like this weird feeling of like, if somebody could just help me figure out my life, that would be amazing.
Yes.
So
Yes.
I enrolled in this course for a year and found language that my personality type, we actually thrive with helping people get what they want, coaching, habit change, all those types of things. So that's when I recognized, I'm like, okay, healthcare, still the space I want to be in, but just in a different capacity.
That's so interesting because I was just reading a book recently that the overall theme of the book was that healthcare in the West generally is, okay, you come into a cardiologist, you're having a weird rhythm or you're having pain, and we are looking at the body as the function. And what about the function or the structure of the body is broken? But I think something that we have all really tuned into over the last 3 years since COVID, of course, is that our mindset and our internal, our self-talk and our spirit even are a huge part of our health. And it sometimes went unnoticed when we would go to the doctor because really, we've got to deal with empirical evidence at the physician's office, right? So
Mhm.
do you feel like sort of this recognition for you of, hey, I know that I'm working in cardiology, but these people actually have something else that need to be addressed? Was that something that you were recognizing when you felt like, I feel like there's more here?
Yeah. So I would definitely say that stress being one of those things
Mm,
that we were never talking about in the cardiologist's office, right? So I have 15, 20 minutes to see a patient. So I'm talking about medication side effects and talking about their disease process. So like cardiomyopathy, atrial fibrillation, congestive heart failure, all those things. I'm having to get into the meat of like what their disease looks like. And then like at the very tail end of those conversations, they're like, yeah, but isn't there anything in my diet I can change? And I'm like, there's something to that. Why are we not addressing that? Or like for those that were working really long hours, they would still think about that. But then in my mind, I'm thinking, well, how are they even going to have time to cook or do all of those things? So it's really behavior and habits that we're having to focus on. So that's when I got really excited and learning about all of those things. But you're absolutely right. Most of medicine isn't dedicated towards those types of practices. It's just disease process and medication and side effects. And then all of that loop goes over and over again. So it's just cyclical to finding
mm,
the right formula for patients, which has nothing to do with lifestyle change.
yeah. And where do people start with that? I mean, if someone's saying, okay, something isn't right with me or my team or my mindset is like funky right now. Like
Mhm.
I'm not myself.
Mhm.
How does that present? And what are some of the things maybe that, you look for when you are
Mhm.
sitting down with someone who say is like a practice manager or a physician?
Mhm.
And you're like, okay, these things are telling me, just like you shared with the, hey, can I change my diet? Like, what are some other things that
Mhm.
flag you to say, oh, we've got some work to do here?
Yeah. So that can look a variety of different ways. Individually, it's usually like, I'm just tired. I'm tired all the time. And I just don't have the same zeal that I had to go to work.
Yeah.
Even though they know they're like in the work that they love to do, potentially, there's a lot of other factors besides work that can contribute to just this level of fatigue.
Mhm.
Other things are just like negativity, like, the World Health Organization says that like burnout is decreased professional efficacy, so inability to make high level decisions, or it's really hard, negativism or cynicism towards the job, and then just really like a sense of fatigue. So I'll ask like sometimes if it's the individual, any manifestations that are physical, but a lot of it is like I just don't feel right. And it's like this stuck, overwhelmed feeling, frustration, lack of hope is a big thing for burnout people that I'm working with. Are like, I just don't feel like things are going to change. So those are some of the individual symptoms that I'm looking for. Organizationally, biggest thing is turnover. We can't
Mm,
retain our people.
yeah.
So
Yeah.
we
They
have
won't
no people,
stay.
right?
Yeah.
They won't stay. So that's a massive issue, right? If you don't have the
Yeah.
staff to do the work that you're doing, your patient outcomes suffer. You have the inability to take on as many patients as you would like to take on. Other things are they're hearing the words burnout. So the administrator's hearing the words burnout. Like my staff is just burnt out. We don't know what to do. We don't have a burnout prevention program. So what does all of that look like? How can we support them? So those are typical things I'm seeing. So financially, it's hitting them, and then organizationally, they're just hearing frustration consistently from their people.
Yeah. Do you think, it's interesting, burnout, right? I mean, burnout, I feel like is now this great big buzzword. Everybody's talking about burnout. Do you think that the definition of burnout or the level of burnt outness has changed or become different from, 10 years ago, maybe from when you were practicing?
Mhm.
Does it mean
The
something different now? You know what I mean?
Yeah, so it's so funny that you say that because I remember going through rotations, Claire. And I mean, this is a long time ago. I've been a PA now for 17 years and just don't practice in the same way that I used to. But the funny thing is, I remember going into rotations and there were some of the nurses or other docs that I'd be working with and be like, oh, Dr. So-and-so is jaded. That was the term they used. And I'm like, I put like two together now. I'm like, oh, they were burnt out even then. Like they were just so sick of the practice of medicine for some reason, whether they were working long hours or something system related. And I don't know exactly what those, folks were experiencing, but I think it had to do with that. I think that was the term that we were using pretty frequently before.
Oh my gosh, jaded. Yeah, absolutely. So it sounds like, when it comes to being burnt out, and I'm sure this isn't blowing anyone's socks off, but it can affect everyone involved in the patient setting. Clearly the physicians and our clinical people, but also office management.
Mhm.
Also, then it's affecting finance because it's going to affect the overall health of the business. So gosh, I'm sure many people here are thinking, putting their hands up like, yes, burnout has definitely happened to me. So where does someone start so now we've identified it, and these are the kind of things that people are hearing. Your staff's talking about being burnt out. Your physicians are maybe jaded or now also using the term burnout. I mean, I've met a few people who like, this is truly their business is now helping people like you do with battling this burnout. So what do they do and how do you help them?
Yeah. So one of the biggest frustrations I see is people try to throw self-care at it.
Yeah.
Oh
Yep.
man, nothing drives me more crazy than that, honestly, because pizza parties, yoga are supposed to fix everything, and it's not the case, right? Or long walks or bubble baths or some junk like that, and it doesn't
Yeah.
help. And then they're like,
Yes.
well, we tried to solve it. We were resilient people. We just tried to solve it and nothing got better.
Yeah.
So it is deeper than that. And I always say it's transformation. It's not just throwing self-care. It is the person understanding themselves on a really deep level. So, first, I guess, step towards that is acknowledgement. In my opinion, it's like you have to acknowledge something's wrong and you have to be willing to do something about it and not just go after self-care. When you're talking about transformation, it is a process to walk through. So if somebody's burnt out, it's already 6 months to a year before they can get back to the normal cognitive function.
Oh,
So
wow.
it is a long time. And if you're really doing the work that's necessary, that's absolutely true. So you really have to hit it at a level of like, what needs to change in your life? Is it something at home? Is it something
Mm.
at work? Or are there conversations you need to have? And it is diagnosing from every angle of like, what is the cause of what's happening here? So when you look at healthcare, there's external factors and there's internal factors. So external factors being the system that you're working in, the office that you're working in, the collaboration of the team, your leader, if you can have open communication with them. Internal factors is what I'm really targeting because you can change. You have the only thing you have is the ability to change is yourself, right? So I am talking about the internal things like, do you have perfectionism? Are you a people pleaser? Are you burning out at both ends because like you can't bear the thought of somebody else and delegating to someone else? So we're kind of hitting those internal personality constructs, which can cause some issues if we don't solve those. And it's not really a
Mhm.
solve, it's like deal with them or recognize them so you can have the potential to work in the opposite direction of them.
Yeah.
So yeah, so it is a transformative process. So acknowledgement and willingness to actually go through the process are like the first steps. And then finding a path that's right for you, whether that's a coach, whether that's initially going to therapy, honestly, it's a great thing to do. Looking at your overall work-life balance. People hate that term and I get it. Um, so what we usually will say is like, how are you integrating work and life? Like, what does that look like? Is it a healthy balance or is it not?
I really like that. You're right. There is a real stigma about work-life balance. I think a lot of people consider that as, oh, if you have a work-life balance, it means you're focused on not being on the job.
Mhm.
But
Yeah.
really, how else can we be effective if we're not taking care of the whole picture?
Mhm.
So when you do this kind of coaching, is it generally individual or is it something you do as a group?
So it varies. Honestly, it varies. So there are some individuals that I start with, and then it can go throughout the team. Or there are some organizations that are like, nope, we need to start with 40 of our leaders. Let's just jump right in.
Mhm.
So, and it depends honestly who is the administrator or the executive on those teams, because if they have a vision for expansion, so let's say they're relatively healthy. Let's
Mhm.
say they're like, okay, we are, not experiencing crazy amounts of turnover right now. And we have this idea of expansion that's going to be pretty rapid over the next 3 years, but we need
Mhm.
healthy leaders to be in those positions. Those are the people who are like, yep, let's go ahead, jump in. We need 40 people to go, and they'll offer it. And I had a clinic recently that I started working with, same thing. They're like, we just need to get about 40 people started. So a couple
You're like, oh, is
conversations,
that
and
all?
that was it. Yeah. I'm like, okay, let's go. And then there are other organizations that are like, let's start with 5 or 10, or let's just start with with me first, get me healthy, and let's go from there. So it's variable, honestly.
What? And I really like how, part of this is the personal assessment and then understanding where our strengths lie and where we need help, or maybe if you're a perfectionist, what the dark side of that can be, and then how to move forward. It kind of reminds me of a conversation I had with Courtney Turek not too long ago. And she's big on using Strengths Finder to identify where the strengths lie on her team. And when we were talking, she said, yes, Claire, I mean, we do identify strengths, but understand every strength has a shadow. And the shadows aren't necessarily a bad thing, but it's something that you can learn so that when you're trying to be at your best or when you're stuck, it can help us to understand why. So say, I'm a team or I'm a leader of a team and I've got, Becky Wolfe leading us, and we're really learning to understand ourselves and work better together. Like, what are the possibilities for a practice when they do start to implement this kind of leadership and this kind of coaching? Like, what would it used to look like, and what's the possibility for that situation?
Yeah. So traditional leadership in any organization, not just healthcare specific, but it is you're really good at your job. Let's go ahead and promote you. And let's go ahead and have you lead 5 people
And
or
good
10
luck
people.
figuring out how to do it.
Right. Exactly. We hope
Yeah.
you've had great experiences because we need that. So, um,
Yep.
but alternatively, when you take a step back and now you can see there's so many things you can use to help you really understand people much faster, it changes the game. So I partner with a company called Giant. We use something called 5 Voices, which is based off Myers-Briggs. So that's been data that's been studied for 100+ years. And um, the 5 Voices is something that people can understand really easily, and they can understand the tendencies of each voice. So I'm a first voice creative connector pioneer, and one of my very best friends is a guardian, very opposite to me. And so
Okay.
I know his tendencies, what he needs for me, as far as communication, how to bring up like details. He needs a lot more details than I do. So if we're talking about making plans, I'm like, I have to make sure I have very specific plans for this person, because if I don't, he could get irritated. He doesn't, because he cares about me, loves me. But in a setting, if you're talking about an organizational setting, so company that I work with right now, I have a guardian who is a leader, leads about 12
Okay.
people. What can happen on the other side of a guardian is they're so task oriented, and they're so good at details and diligence and making sure everything is on time, on budget, is they can sometimes not be as personal as other feelers and people might want. So I'm a feeler. So I'm like, it can be, if I, now that I see it, I'm like, oh, they're just a guardian, no big deal, because I know like that's not their maybe the warmness and stuff is not typical for them. But
Mhm.
for me, I lead with character. I'm like, I love people. So it's easy for me to grab onto that. For them, they're leading with competence. I'm like, I know my job well. I can crush anything you set for me. Right.
Mhm.
So if they're leading a group of 10 people who might be feelers, they have to bring a certain warmth to them. They have to bring a certain, like, I have to get to know these people. So they know their tendencies and they have to kind of morph into whatever other people need from them. And then same thing from the people who are in that subset of 10 people. They're like, they're a guardian. So if things come off maybe a little bit more direct, I get it. So that's like a tangible way, I guess, to understand it, of if you understand your tendencies and someone else's, it makes communication so much easier.
Oh my gosh, no kidding. And it kind of reminds me of recently my husband and I were quoting a new project. So we had a company reach out to us and say, hey, it was somebody who was a client of ours before with resumes. And they said, hey, now that I'm leading this organization, can you help us with some content? And I said, yeah, of course. Like, we'll do leadership content for your leaders. It's kind of an extension of what we did for him anyway. And so my husband helps me a lot with business. And he said, okay, well, we've got to quote this project. And I said, okay. I said, well, with everything he's asking me to do, it's going to be about, this much. This timeline feels about right. Right? I'm sure you're like now sensing where I'm going with this. And this is where I would price it. This is when we can deliver. And these are the things that'll be included. And generally, these are the people that'll be involved. And Chris looks at me and he's like, okay, can we put some numbers to this? And really, we sat there because he's much more, analytics minded when it comes to this with project management. And so quite literally, I felt the heat rise in my body because I was starting to like sweat. Like I have such a good feel for what things need to look like. But when it comes to penciling them out in that way, it's not generally where I begin. And that's what makes us a good team. But it was interesting because it was really the first time that he and I had put one of these together, and it really spoke to the differences between our personality types and why we so desperately need each other. So, I guess all that is to say, is there like a power combo when it comes to, you're looking at an office and you're like, gosh, you guys are all feelers. You really need a guardian. Or, if you could hire your next person with sort of these strengths, it would really round out the organization. Is there a secret sauce or a perfect combo?
So it is helpful to have as many of the voices represented as possible because they each bring their thing. So, and some of them, the percentages aren't as high. So like nurturers, for example, are 43% of the population.
Oh,
that's
interesting.
Almost half. Yeah. So it is crazy. So they're a very high percentage population. Guardians are 30%. So that's already a large majority of the population, right? 73%.
Yes.
So when you're thinking about the other voices who are future oriented, there's less of those, but you need them for innovation and driving like what is new and coming. And the guardians and nurturers are so special because they are focused on probably pretty much like your husband, like the numbers and details and data and the people and the genuine relationships, the relational capacity. Whereas like me, I'm thinking, what's 10 years down the road? How could I bring that like forward, right? So you need all the voices, as many as possible, because that's the secret sauce of, we have like somebody driving innovation. We have somebody who is like really good with connecting large groups of people. And we have somebody who's really good at the details. So our nurturers and guardians that are really, really strong with details. They, again, will deliver everything on time and on budget. They're just so good at the small things that a lot of the other voices would miss. And they're really good with systems and organization. Then there's the creative, which I'm a first voice creative. So we're thinking furthest out into the future of what could be, thinking about large opportunities for people. So innovation is really something that we're strong at, and thinking of solutions outside the box. So that's the creative. The connector is probably exactly what you would think it to be. It is the people who just love connecting other people. So have huge relational networks. They love being able to put people in positions to win. So they'll make the connections between people because they just love seeing advancement with people and growth.
Mm-hmm.
And then there's the pioneer. So they're almost militaristic in how they view the world of I can win. I want to leave a legacy. Nothing is too big of a picture for me.
Mm-hmm.
So they're very, very strategic. So they're thinking out towards the future too. They're about 5 years out and looking for opportunity for business most of the time.
Oh my gosh. Okay. So, and for everybody listening, I'm sure as Becky's describing these things, you're thinking, oh man, like I'm definitely a 3, or like I'm definitely a 2, and like maybe a little bit of a 5. So put in the chat, this will be fun. Put in the chat which of the 5 voices you maybe lean most into, or like a couple of them that you're resonating with. And so, back to kind of what you were saying before, it's great if you can have as many of the 5 voices on one team, because I'm assuming we all are like interlocking pieces here. It's a little bit like a puzzle.
Yep, it is. It is. So when you have a team, and I've seen this work, like the work that I've done over the past few years, it is awesome when people recognize there's these light bulb moments. They're like, oh my gosh, this is how it's supposed to work. So I was working with a connector and a nurturer. And in our core group session, we're talking about the connector strengths and the nurture strengths. And they beautifully navigated how they've worked together in the past. And they're in separate stores now. It's actually a restaurant, but they're in separate stores now. But they were like, oh my gosh, do you remember when I used to have all these ideas, and then you used to help me out and like narrow them down to what was actually going to work real time. So the nurture being present oriented, like navigate like what's actually going to be possible in the moment.
Yes.
And my connector friend is like, oh, I've got so many great ideas because we could do this, and this. And then his counterpart's like, no, not possible because we don't have these resources. So he narrowed them down. I'm like, that's beautifully an example of
Oh
what it
yeah.
looks like. Yeah. So those are just like 2 of the voices that were represented. I'm like, that's a beautiful example.
Oh my gosh, this is so fascinating. I don't know. I think there are many things like that I've had to do, and I'm sure many people here listening. I mean, if you're in sales, if you're in medical sales for sure, you've definitely taken a Myers-Briggs. You've probably taken the disc, right? You've probably heard of an Enneagram, because we're always kind of striving to understand ourselves. But I think that there's probably a great time to start doing this. So like, when would you recommend that somebody, for example, do the 5 voices? Is it when they become, is it when they get into a leadership role, or is it maybe before that, or maybe it's every couple years because can it change? When should people do this?
So as a new leader, it's really helpful because you can understand your leadership voice and understand how people will experience you. So self-awareness is the ability to look in the mirror and understand how people may perceive you. So that's always a great idea. The other thing that I would mention too, like doing these for your own growth
Mm-hmm.
is incredibly helpful because again, you're in usually some type of relationship with someone, whether that's in a family or whether that's in soccer or whatever, whether that's in like community with church or whatever that could be. You're in groups of people. So your own growth, it will help you exponentiate that when you're able to do one of these assessments.
And again, as much as it is so helpful to do these assessments, do you think that repeating them through your career is a good idea, or do these generally stay the type of voice or the type of personality trait, strength that you are? It's not going to change.
So typically it doesn't change, and there can be some discovery for these too. So what happens is leadership behavior is driven by 3 things: nature, so that's usually the personality or wiring, and then nurture, which is how you're brought up, so the environment in which that you grew through, right? So schooling, parenting, all of those kinds of things in your family, and then the choices that you've made thus far. So those all drive who you show up as now. So having said that, I'll have people take the assessments and I'll go through it with them live. And sometimes they will shift or change because we've discovered that they've taken on what their parents wanted them to be, or what society feels like they should be. So we're uncovering like that's not really naturally who they are. And I actually had that experience. I'm like, oh, going through, I'm like, I've got to be a nurturer. There's like, I was driven to be a nurturer. I'm in healthcare and, taking care of people. And then I'm like, no, I'm not a nurturer. That's actually my fourth voice. So there's a
Oh,
continuum
wow.
of the voices. So you can recognize that those are not who you are.
Got it. Got it. And
Mhm.
were one of your parents a physician?
No, no. My mom was
Okay.
in healthcare though. She worked in the healthcare setting for her entire career. And here's the thing. I had my parents take this, of course, and then I had my sisters take it. So I'm like, I need to know who I'm dealing with here.
Oh my gosh, I love it. I wish I could have been there for like the first holiday you all got together after you took these tests.
So
Okay, so
my mom is a nurturer. One of my sisters is a nurturer, and then my other sister is a guardian. My dad didn't take it, but I let him get off the hook. But so everybody's presentorian. They're like in the day-to-day details are their thing. And I'm out
yeah.
in left field. So I'm like the oddball in my family.
Oh my
Um,
gosh.
yeah, so
You're
just
looking
funny.
at your dad like, Dad, you've got two choices. You could be a connector or a pioneer because we need to
Right,
round this out here.
right,
Oh my
exactly.
gosh. That's so fascinating. So now when you relate to your family even,
Mhm,
you
mhm,
know kind of what their needs are, or maybe the perception of the information you're giving them is
mhm.
affecting them, and then understanding their responses at a completely different level.
Yep. Yeah.
Wow.
So my nurturer sister and I, we connect on a different level now. She knows the language. She actually uses it in her company. And it's interesting. She's really dove into it. She's like, she recognizes I need freedom and space. Like that's where I thrive is when I can ideate. So we'll be talking on the phone and different things that were like, even like vacation, something as simple as vacation. I'll be like,
Yeah.
I just need space. And she gets it. Whereas before we would schedule our day from like 8 a.m. until like 9 p.m. Right. And I'm like, I need space to be alone. I need space just to think and like see nature and all these things. And it's so simple, but I never knew to ask for it before.
Wow.
And for them, like being around people, like being the internet, like tight family, that's what they wanted. And I got it. So I'm like, I'll just go through the motions. But
Yeah.
when there's the awareness of what you need, you can ask for it.
Oh my gosh. This is so fascinating to me. And it reminds me, so my husband and I are very different, in personality type, which is great. Like I said, this business wouldn't run with just one of us because I'd be like assuming everything and like just creating, but he brings it back to a real level and then gets done by the numbers. But he's also a provider. And I've watched him. I think if I had to guess, he's not here, which he would laugh at me right now if I was saying this right now. He's gonna watch this later and be like, "Really? You talked about me on your podcast? Cool." But I have a feeling he is like some combo of a nurturer and a guardian, maybe,
Mhm.
because he's got those two. This is so fascinating to me.
Mhm.
Okay,
Yeah.
so I mean, so for everyone here who's also now trying to figure out their spouse's personality type, you don't have to put that in the chat. But just from this conversation alone, I've taken away some biggies here that I think are really important and things that we want to make sure that we're considering when we go into leadership or when we're relating to that boss that we kind of can't stand and they just don't get us. And we're thinking, listen, it's going to have to be his way or the highway and I'm out of there, or she's driving me nuts. I can't be here. Maybe by understanding our personality and their needs as well, their voice, our voice, it could be a way to build that bridge and instead offer a third door of there's another way that we can move forward. So a couple of things I've taken away already are the 5 voices. And thank you so much for sharing with us. So we've got the nurturers, guardians, creative, connector, and pioneers. And the second thing that you mentioned right here at the tail end that I love is that there are 3 major effects of our life on how we lead. And it's nature and nurture, which we hear a ton about in the world, right? But not as much about choices. So I really like that. And I'm hoping maybe in the future we can come back and even just sort of like, drill down on that
Mhm.
concept too. But for people who want to become a better leader and maybe to become the leader you need, what's the first step that someone can take when they want to improve themselves in this area or improve a situation at work by better understanding themselves and each other?
Okay. So kind of have a two-part answer to that. And I love how you said that, Claire. That's beautifully articulated. Be the leader that you need. because I think that's a different motivator too. When you're thinking about like, why would I become like a leader that my boss needs? But if you do the reframe on that, like if I become somebody that I would want to be, or that I would want to lead me, that's a different reframe on it. So a couple of things I think of is do a personality assessment. It doesn't have to be 5 voices. It can be MBTI, it could be Myers-Briggs, whatever. Enneagram could be StrengthsFinder, but just kind of learning about your wiring in some capacity. And then the other one is ask good questions. Get really curious. Like it's so simple, but it is a game changer. So just step back and get really curious about people's motivations. Because when you do that, you're kind of inviting them into a conversation then. You're already inviting them into better communication. So if you're struggling to communicate with somebody or build a relationship, take a step back and just get curious, because what will open up in communication relationships from that is unmatched. It will change how you respond to that person and how they respond to you.
Phenomenal. I'm sure that we've chatted for 30 minutes, and if anybody else listening is totally inspired as I am, because you, through your career, go through so many tough situations, most of them interpersonal. And this might be just one of the absolute best ways to solve a lot of the problems that feel unfixable. So if anybody else is inspired as I am, I'm sure they want to connect with you and find out more. And what's the best way that they can do that?
Yeah, so I'm pretty active on LinkedIn. So Becky Wolfe on LinkedIn, that's a great way, or just Becky@BeckyWolfe.com.
Awesome. Well, thank you so much for joining us today. Seriously, I am on fire with this conversation. It's also making me, it's also bringing up a lot of questions and thoughts about like parenting and what
Yep.
what
Oh
I'm going to
yeah.
say to my boys when I pick them up today, and get even more curious about their day. But I just want to thank you so much for what you're doing in healthcare and beyond, because like you said earlier, this isn't limited to the healthcare. Of course, this is a way that leadership can really make huge inroads and fix major issues, and help people to really thrive as a whole. So I am so thankful for what you're doing. Thank you so much, everybody who joined us today. It's great to have you here. Connect with each other in the comments, and do not miss your opportunity. I know you've got a busy day ahead, but don't miss your opportunity to go check out Becky's profile. Make sure you're following her. I learn from her weekly, and I'm so, so grateful for everything you're doing. So thank you for joining us. And until next time, we will see you later. Thanks, Becky.
Thanks, Claire. Thank you.